Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're discussing signs, symptoms, and treatments of hip and knee arthritis. Next, we're talking with Chosen One Movers about the unique challenges for seniors or caregivers planning to move or downsize. Finally, we're communing with nature and learning all about Sunset Wildlife Connection. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Osteoarthritis is the most common form of arthritis, affecting over 32 million adults in the United States. The prevalence of arthritis increases with age. Here today to talk to us about what arthritis is, along with the symptoms and treatments that are available, is Dr. Kevin Fox, an orthopedic surgeon at the Andrews Institute. Thanks for being here today, Dr. Fox.
Yeah, thanks for having me.
So first of all, what is hip and knee arthritis?
So the most common type is osteoarthritis. It's what occurs when the smooth lining of your joints, cartilage, starts to wear down. Over time, it can cause stiffness, pain, and sometimes swelling in the joints.
And what are the early warning signs that someone might have this?
So most people start to notice some aching in the joints, some pain during the day, and over time it can become more progressive and wake you up at night and cause stiffness when you're sitting down for a while.
And when should someone see a specialist, and how do you know if it's just kind of the normal aches and pains of aging?
Yeah, so when joint pain starts to last more than just a couple weeks and starts to affect your quality of life, coming in to see a specialist is a good idea to get evaluated and start some treatment.
So when it's kind of preventing you from taking part in activities and just stopping you from doing the things you want to do, you might go see a specialist?
Yeah, exactly. So if you're not going for walks with friends, seeing your grandkids because of joint pain, it's a good time to get evaluated, get fixed.
So what treatments do you try before going to surgery?
So we typically start with non-operative treatments. Those consist of physical therapy, some medications, and joint injections are very effective as well. So we always start with those non-operative things first to try to get people some relief.
Gotcha. And when does surgery become the right choice?
So when the pain becomes continuous and affects your quality of life, despite trying conservative treatment, surgery becomes a good option. For knees, the treatment can be a total knee replacement or a partial knee replacement, depending on the type of arthritis you have. And for hips, it's typically a total hip replacement.
Wow. And are patients ever too old for these joint replacement surgeries?
So age alone is not a deciding factor for total joint replacements. It's more regarding their overall medical health and how they are overall. I have patients in their 70s, 80s, and even 90s that had joint replacements, and they're very happy they had it, and they're doing very well.
Yeah. And how long does the recovery for a total replacement usually take?
So after a total joint replacement, we have patients up and walking the same day, typically going home the same day with home health care or the next day. First couple of weeks, there's a rapid improvement, and folks are typically getting back into their things they like to do within 6 to 12 weeks, typically.
Is there a physical therapy involved that all people go through after a surgery like that?
Yeah, so after surgery, you go home, and we have home health care that comes out, and they help do physical therapy in your home. And once you come for your 2-week post-operative appointment, we typically get folks set up with outpatient physical therapy to help them slowly transition back into the things they like to do.
So tell me more about what that whole joint replacement looks like, because it seems wild that you can be back on your feet after getting a whole new joint.
Yeah, so when joint replacement becomes a good option, once we relieve that arthritic bone that's causing all that pain, patients tend to feel a lot better right away. So we resurface that joint and essentially replace the cartilage with a new component, and it helps people move their joints easier and get back to being mobile again.
And what does a partial look like?
Yeah, so a partial is when arthritis is isolated to just an area of your joint and not the entire joint. So we're able to selectively replace certain areas of the joint if the remainder of it's healthy. Typically that's for somebody that had a traumatic injury in the past and had worn out one side of the joint preferentially. We can go in and replace just that one portion in the knee.
Okay. And what would you say to someone who's nervous about seeing a surgeon for arthritis?
So, seeing a specialist doesn't automatically mean you have to have surgery. You come to the office, we get x-rays, we evaluate, what's causing your joint pain. And then we talk about all the options and we see, what the best option is for you. Sometimes that's starting a conservative treatment path. Sometimes that's surgery. So, it's really getting all the information to patients and they make a decision on what's best for them.
And what is the cause of arthritis? You mentioned that sometimes it's caused by kind of overuse or a traumatic incident. What causes it?
Yeah, so arthritis is just osteoarthritis is just a wear and tear that happens throughout our life, from daily use. Some people believe it might be somewhat of a family history of arthritis, might make you more prone to it. But oftentimes it's normal wear and tear, and it's a normal part of aging. And some people suffer from worse arthritis than others, and those are the patients that really benefit from joint replacement surgery, at least some conservative treatment to help them get along with their day without much pain.
Absolutely. Anything else that people should know if they're starting to feel maybe knee or hip pain as they're aging, what to look out for and when to call?
Yeah, so when you have a couple of weeks of pain and it's just not going away and you're concerned about what's going on, it's not always arthritis. Sometimes there's other causes of pain, and we're able to, investigate that and evaluate it and find the source. And sometimes it's an easy fix that doesn't require any surgery. So, it's always good to come in and get evaluated and just make sure we find out what the source of your pain is.
So if you're having that pain that's bothering you, come in and get it checked out. Don't kind of wait because you're nervous that it might lead to surgery. And also something we always say is if you are an older adult and you might need that surgery, your recovery is going to be better now than it ever will be because you're probably in better health than you ever will be.
Yeah, absolutely. So, when your joint is worn out, you don't want to wait too long, because then when you're older, you obviously have more medical comorbidities and surgery can be a little more risky in terms of your medical health. But when you're younger, we're able to recover faster, work through physical therapy better, then you have more years to enjoy your joint as well. So you're able to really enjoy life again while you're still wanting to do things.
Yep, absolutely. Well, thank you so much for sharing this with us.
Yeah, thank you for having me.
Stay with us. We're packing up and moving with Chosen One Movers next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
The task of downsizing or just moving homes is daunting for anyone, And for older adults and caregivers, there can be additional challenges. Chosen One Movers is a moving company that has plenty of experience helping seniors make a transition. And we have owner Craig Edmond with us to share some strategies to help you through the process.
What?
Thanks for being here today, Craig.
Thank you. I'm glad to be here.
First of all, tell me about your business and the services you offer.
Yes, we've been in business now for nearly 20 years here in the Pensacola area, serving the area for 20 years, like I say, and we specialize in packing services, commercial, residential, and we also do protection of furniture as well. The business have been extremely profitable for us. We enjoy doing the work here in the area and for the customers and clients.
And what are some of the unique challenges you see that seniors or caregivers helping an older adult face when it comes to moving?
Well, what we notice a lot is communication. We always tell a lot of customers and clients when they call and book and schedule a job to make sure that that we prepare in a way that we know what we're doing when we show up. A lot of times the clients have problems with space and being able to make that transition when they move. So we always ask that we have enough time to be able to come in and see what they have so we can kind of help them make decisions for us, what need to take, what not need to take.
Right, like if someone's downsizing and they have more furniture than their next home is going to fit. So how do you deal with those challenges when you are helping a senior or a caregiver with that process?
Well, what we do, we come in, we kind of strategize, what kind of space they move into to determine on if, a bed or a sofa would fit in that area. We help them, lay out floor plans as we go through. And one of the most important things is, like I say, is communicating. Being able to make sure when we show up that, we being respectful, being communicated with the customer so that the family, that they're dealing with a company that's going to provide a service, that's providing for the services that they're looking for.
Mm-hmm. And we talked a little bit about how you help people downsize. So you can really tailor the services and get in there helping somebody, let them know this maybe isn't going to work in this space, and we might need to find a smaller sofa or a smaller bed, right?
Right, yeah. We do that all the time. Sometimes, the client, they have a problem with getting rid of certain things, and it can be stressful. So we notice over the years, sometimes you just have to be a little patient, you know what I'm saying? Even if we have to take a piece in to let them see that it's, it's too big for the area or not, and we'll have a special service just to come back and pick it up and take it, donate it or give it to a family member or something like that. But it's all about patience and just being able to listen.
Absolutely. There's definitely an emotional component for a lot of older adults when it comes to making that kind of transition. Are there any other things that clients that are older adults or caregivers can do to help prepare them for making a transition like this?
Yes, I would say make sure that you be preparation, because there's a lot of things in place that's got to happen the day of the move. Packing, if you need packing service, like I say, communicating in the beginning, let us know that we need packing service. We had one client, Miss Buck Walter, she was moving from a facility, and she didn't let us know that she was going to need packing. And when we got there, we realized we had packing to do. So we actually started putting extra material on the truck just for that moment, because the communication can get broken down between the phone call and the day to arrive for the move. So what we did in our business, we make sure that we have extra supplies on board just to accommodate that. And also communicate with the family to make sure that, they have the medicine and stuff like that organized as well.
Yeah. And so I actually heard about Chosen One at an aging services professional group. So y'all are really trying to reach out to this age range to help them with these kinds of transitions and moving. How else do you kind of look for those types of clients?
We do a lot of meet and greets. We send out a lot of mail. We advertise online. We reach out to people in the community. So being able to get in front of the seniors and let them know that we have a premium coming in that we offer for their services, so that they won't have to worry about it, to take away the stress every day. Because like say, it's a tough thing to move from one location to another, especially memories that's being left behind and stuff like that. So we like to provide that service for them.
Absolutely. And what else would you say to maybe a caregiver who is about to start, or they're ready to start talking to their loved one about making a transition?
Make sure that you're prepared. It's not going to be an easy transition. Try to communicate with the family as much as possible, making sure that, the packing and stuff is done. If not, you hire us to come do it. But I would say communication is key, making sure you separate stuff and be prepared the day of the move.
Mm-hmm. And you're there to help make that a smooth transition for them when they do get started with that.
Yes, ma'am. We are there to help them out. We'll come in and make sure that we be respectful and have the patience to work with the seniors, because sometimes, they get a little overwhelmed, and we're there to help bring down that stress level on a day-to-day basis for them. Supply all the supplies and make sure that we label and mark in boxes, and not just that we break the furniture down, but we put it back together for them too. Absolutely.
Awesome. Anything else you want to share about Chosen One Movers?
Well, I can say, Chosen One Movers is ready to move all seniors. If you need, help with moving, especially here in the Pensacola area, we're eager, and we send out a great team of guys to do a professional job for them. We offer a premium service where you can't just hire a mover to do it. You got somebody who's qualified to do it.
Mm-hmm. Okay. Wonderful. Well, thank you for sharing this with us.
Yes, ma'am. Thank you for having me.
Up next, we're getting a little wild with Sunset Wildlife Connection. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Sunset Wildlife Connection is a nonprofit exotic animal sanctuary dedicated to animal education and wildlife conservation. You can find them at their sanctuary in Molino and at outreach events around the community that help people better understand animals and their place in the natural world. Today, we have co-founder, president, and lead wildlife specialist, Margaret Lynd, here to tell us more. Thank you so much for being here.
Thank you so much for having us.
So first of all, tell me about Sunset Wildlife Connection and what your mission is.
So, as you said, we are Sunset Wildlife Connection. We are an exotic animal rescue and community outreach program. Our mission is to educate the public about the importance of wildlife with our unique wildlife connection encounters. So what we do is we rescue exotic animals, train them to become ambassadors for their species, and then we do outreach and education with the animals.
And what kinds of programs do you offer?
So we offer three main types of programs. We offer a Zoo to You encounter where we bring the animals to you, whether it's a birthday party, a library, school, festival, wherever you want exotic animals, we can bring them out to you. And then we offer on-property encounters. So we have tours, we have a VIP tour, we do a Zookeeper for the Day program. We also host events and community events at our property. And then the third way we educate is actually through social media. So our main ways are through Facebook, YouTube, TikTok, and Instagram. And we post almost daily. Sometimes it's something goofy, and sometimes it's, education. Sometimes it might be about our events. So we do all kinds of social media work online as well.
And I've been seeing a lot of that lately because I was Googling around and looking at some of your events. So tell me about some of the animals that you have.
So again, we're an exotic animal rescue. So we rescue anything that is not a domesticated dog or cat. So we have everything. We do have domestics. So we have animals like rabbits and chickens and goats, but we also do exotic animals again. We have a full reptile room with snakes and lizards. We also have prairie dogs and then larger animals such as foxes, lemurs, and a porcupine.
Awesome. And tell me about some of the events that you have coming up.
Yeah, so we have a lot more spring events coming up. Here we have the goat yoga coming up. We just did one event with some brand new baby goats, so we will still have baby goats. We also are going to be doing an animal baby shower since we have the baby animals. We have baby chicks, and then I'm pregnant, so we're kind of just doing a full celebration of that.
Awesome.
And then we're also going to have some spring break stuff. So we have an open house for spring break as well as some camps.
Wonderful. So let's get to it. Who do we have here?
Yeah, let me grab him. Come here. So here we have a chinchilla, and chinchillas are originally from the Andes Mountains in South America. So this here is Raichu, which if you didn't know, that's a Pokemon. But they are nocturnal, so I did have to wake him up to come here today. But they have a lot of adaptations that you can see to help them be nocturnal. So he's got those big ears and big eyes to be able to hear and see well. I always ask kids, I'm like, do you think he runs around with his iPhone flashlight? And they all giggle, nope. So he has to use like the moon and everything. And these guys actually have very long whiskers. So if you look, he's got whiskers almost the same, like half the length of his body. And that is because, again, at night, he can't see very well. So he has to be able to use those long whiskers in a very complex environment out in the mountains. They also cannot be above 80 degrees. So if they are above 80 degrees, they can start having heat stress. They have very thick fur. So that's just something, if they are a pet for somebody, that you have to consider, especially here in Florida. I actually can't use him. He's about to go out of his season because I'm not going to be able to use him anymore since it's going to be over 80 degrees here in Florida pretty soon.
Which is understandable. Who wants to be in over 80 degrees?
Right.
Too hot.
You said you had one as a pet. What do you think of them as pets? Do you think that they make good pets?
I don't think I was giving my chinchilla the life he deserved. He did have kind of his own room, but they do, we were talking about this earlier, they do produce a lot of poop.
Yes, they are rodents actually, and rodents on average poop every 4 minutes. And again, they're nocturnal, so yes, he's cute and fluffy, but especially for kids are awake during the day, right? And they should be sleeping at night. Well, when is the chinchilla awake? The chinchilla is awake at night. So it isn't maybe the best pet for a kid, and again, they do poop a lot, so we do a daily cleaning routine with all of our animals, and then we actually have a deep cleaning schedule with all of our animals twice a week. So we keep our animals very clean, but if you don't use that kind of a regimen, they can get stinky, just like any of your other animals that you don't take care of. Their diet is actually very specialized because they live so high up in the mountains, they don't have a lot of wet food. So they only are actually on hay, pellets, and then a dry old-fashioned oat, and that is like what they use as a treat. So that is nice. You don't have like a full produce diet that you have to give them every single day. But otherwise, yeah, it can be a hard pet, especially, unless you love to clean and you love cleaning poop, which is, job of a zookeeper.
Yeah.
Then, yeah, these guys, can make an okay pet for the right person.
Yeah, and they're so cute.
Yes,
so
they're very soft. Do you want to feel?
I do, yes. Oh, can I hold it?
Yes, you can.
All right. Hello, Raichu. Oh. Did I say your name right?
Yes. I actually always recommend people actually pet with the back of their hand. Since the front of our hands, we use our hands a lot and they're very rough. So because of that, the back of your hand, you can feel them a little bit better. I don't know, he wants to play on the table. He can if you want him to. I'm like, he might bounce around for a sec.
And we were talking about this a little bit earlier, but tell us about how they bathe, because it's not with water.
Yeah, you want something? Oh, there you go. So they cannot get wet because, again, they live up way high in the mountains where there's snow. So because they can't get wet, they actually have a dust bath instead. So we actually, in captivity, have it's volcanic ash that is ground down really, really fine, and then they will actually, like you were saying earlier, they'll roll in it, and it creates this fun little dust cloud because they cannot get wet. If they do get wet, their fur is so thick that it will actually mold.
And that's why they're so soft.
Yes, that is why they are so soft. And these guys were actually almost brought to extinction because of the fur trade.
Wow.
So these guys can still be found in fur farms and used for coats. And it takes about 50 to 100 chinchillas just to make one coat, and that depends on length. Yeah. So numbers are doing better now in the wild, but there for a while, that fur trade definitely almost had them to extinction, but now we have them here in America as pets.
Well, thank you so much for bringing him. He's adorable. I love him so much. I want another chinchilla, but I will just have to come out and visit.
Yes, definitely. In the cooler months.
So how can people get in touch with Sunset Wildlife Connection if they want to learn more, if they want to meet Raichu in the winter months?
Of course. So you can find our website, of course, which is sunsetwildlifeconnection.org. And then from there, you can also, again, follow us on social media. Monetary donations are always appreciated since we are a nonprofit. Everything is tax deductible. But you can also, again, book a tour. You can just email us. We can book a tour, our birthday party, an event. You can check out our events page on our website or our Facebook page to find out upcoming events. We're going to have more in May and summer, and then, of course, going into fall. So, yeah, you guys can find us all over there, and we'd love to see you. So would Raichu.
Awesome. Thank you so much.
Of course.
And thank you for watching. Until next time, enjoy life. You've earned it.